Hello, everyone. This is Dr. Litvin. Um, I've decided that after so many years of presenting to you cases that I've seen and describing the complications of various clinical situations, that I should approach things a little bit differently and try to present some talks about basic facts about diabetes initially, try to explain in the simplest of terms diabetes, and then move on maybe to describing some of the medications we have, some of the insulins we use, how to actually do monitoring and show some of the various gadgets and glucometers that are available to you. This may take a few talks, but if I see that there's a receptiveness to it, I'll continue. And again, this is intended for the general patient who's just been diagnosed with diabetes or has had diabetes for quite a while. So some of this might sound repetitive or oversimplistic to many of you, but just to assure you, I'm constantly seeing patients who are newly diagnosed who have no information and don't understand the basic facts about diabetes. So forgive the simplicity. However, let's just move right on and try to explain a little bit about the basics of diabetes. So basically, we're talking about a situation which is described as hyperglycemia, which means elevated glucose levels in the blood. And for that, we have to define what is normal. And normal glucose levels in the blood depend, of course, on the time of day and relative to the meal that we've just had, or how long have we not had a meal. So glucose levels are typically maintained within a certain range, and this range is more or less, if we use milligrams per deciliters, down to maybe the lowest being 60 milligrams per deciliter, and the highest normally, again, maybe 200 milligrams per deciliter. So within that range, most non-diabetics basically exist. And when I tell patients who have diabetes, I quote these numbers and tell my patients that I'd like them to be somewhere between 80 and 180 overall whenever they check their sugars. So definitely if your sugar is above 200, you are with hyperglycemia or you have an elevated blood glucose. And if your sugar levels are below 60, you are having an experience of hypoglycemia or low glucose levels. Neither is good. Hypoglycemia can be lethal. Hyperglycemia is what we have in diabetes, and that leads to complications. So patients who have diabetes and therefore hyperglycemia are exposed to elevated glucose levels around the clock. And this in and of itself is a cause for concern because when the tissues of the body are exposed to hyperglycemia, there's damage, damage to various tissues. And after years of being exposed to hyperglycemia, typically patients develop complications. We'll go into complications at some later point, but again, getting back to the definition of diabetes. So when blood glucose are consistently elevated, we diagnose diabetes. The diagnosis can be made in various ways. We can either just at random check any glucose levels and define it as above 200 on at least two occasions. That would typically suffice. We can do some testing that is called glucose tolerance tests that we do in the office, where we give a patient to swallow a glucose drink, and then we check the levels at various times. And there are certain criteria for that when being diagnosed. And the third way is using something that's called hemoglobin A1C. And in the hemoglobin A1C method, above 6.5% is considered abnormal and in the diabetic range. So once the diagnosis is established, typically we ask the question, what kind of diabetes is this? And it's been known that diabetes in general is divided into mainly two categories, type 1 and type 2. And here also there are various misunderstandings. In general, in the past, it was described as juvenile diabetes being type 1 and adult onset diabetes being type 2. Other ways of stating this are insulin dependent and insulin independent, and basically what we mean is, does this patient have any insulin? So insulin, as you all probably know, is really the hormone, the pivotal hormone of this condition. Insulin is made in the pancreas by specialized cells, and insulin is a hormone that, which means a protein, a molecule that is secreted by specialized cells that we call beta cells in the pancreas, that is secreted in order to maintain glucose levels in an unelevated way, or rather in order to control glucose levels within the normal range. So when glucose levels rise, especially after a meal, insulin is immediately released. And what insulin does is allow or facilitate the glucose molecules to enter various tissues in the body. Thus, glucose levels decrease. In the absence of insulin, this action does not take place, and there is a persistence of elevated glucose levels, or something that we call hyperglycemia. So insulin is very critical, a very critical hormone, definitely, and it plays a pivotal role in diabetes. We can't really just dwell on insulin without mentioning another hormone that's called glucagon, which is a hormone that's released by different cells, but neighboring cells, also in the pancreas. And the role of glucagon is basically the reverse or the mirror image of insulin, in the sense that glucagon's role is to elevate glucose levels. So we have two very pivotal hormones that control glucose levels in the body. One is insulin, which causes reduction in the levels, and the other one is glucagon, which causes an elevation in the level of glucose. Glucagon is used, some of you might know, as an injection to elevate glucose levels that have plummeted dangerously in patients. We'll get into that in the future. However, getting back to insulin, so as regards to diabetes, insulin levels or the ability to make insulin is critical. And once that is lost, we develop something that's called diabetes. The extent of this loss of insulin production determines what kind of diabetes we have. So when there's total loss of insulin production, what happens is diabetes type 1, or something that was called juvenile diabetes. This is a very dramatic clinical picture where glucose levels are very elevated and can cause acute complications, something that is not seen in the other type of diabetes. And that's when there's only partial loss of insulin levels. Partial loss for various reasons, which we'll mention later. However, in this clinical condition with only partial loss of insulin production, this leads to diabetes type 2 or adult onset diabetes. And in this type of diabetes, we can treat patients with various modalities that we have. And these patients typically do not depend on insulin administration, as do the other group of juvenile type 1 diabetics. So those are the two main groups of diabetics that we have. Type 1, that are completely insulin dependent. Their lives depend on insulin. And type 2, or adult onset, that are insulin independent. And in these patients, we can use other modalities we typically do, such as pills, various other injections, in order to modify and correct glucose levels. So now that we've covered the two main types of diabetes, let's make an intermission, and next video will be about possibly about various modalities of medication that we have. Thank you and have a great week. Dr. Litvin.